Hi everybody, welcome back. So excited to have you with us today. We're actually about to pop in with Dr. Polo as he gives his patient the perfect pout. And we can find out everything we want to know about lip injections. They've been all the craze lately, so we're so excited to show you Dr. Polo's way of doing them and his techniques. So here we go, let's sneak in and see what's happening. Hi Dr. Polo, how are you?
Hi, how are you?
We're doing great. What are we doing today?
Today we're doing lip augmentation with injectable filler. We're going to use Juvederm for the procedure today. We're doing these with a cannula, a blunt cannula, which is a nice technique to try to limit the bruising and the discomfort of the procedure.
Wonderful.
So we got a wonderful volunteer patient here today. We've already prepped the skin, and I gave a tiny little injection of local anesthesia, just a little drop of local anesthesia right in the corner of the mouth.
Just to make it extra comfortable for her, right?
Right, exactly. This is the only, slightly invasive part of the procedure. We make a small little stab incision with this needle. This is a 22 gauge needle, a small needle. And this is all we need for access for this cannula that we're going to use.
So that's the only incision that's going to happen throughout the entire treatment?
One of those on each side of the lip.
Oh, wow.
Right, so this whole technique really minimizes the bruising. With lip injections, we can get a little bruising and swelling, especially the swelling, which can take a few days to resolve completely. So,
why is it that happens? Is it just because the area is sensitive, or does it have to do with the filler?
It's very vascular. We have to make multiple injections if we're using a needle, a sharp needle, to get all the way across the lip. Typically it takes multiple injections. So with this technique, we can use a little bit of local anesthesia. We can make this one small incision, and then we use this blunt cannula, and the blunt cannula causes less trauma overall. Fewer passages of the cannula in general, and it's not sharp, so it doesn't damage as many small blood vessels. So the damage to the small blood vessels is what ends up causing the bruising in the end.
I see. So with that cannula, is it almost like you're threading the filler through, leaving little droplets throughout the lip, or how does that
There are
really
different techniques,
work?
but usually with a cannula as opposed to the needle, yes, we're threading the cannula through. And if you see closely here, there's a small port at the top of the cannula, nearly to the end, not completely to the end.
Not sure if you guys can see
facing
that, but
upward
it's
right
tiny
now.
little right there.
Tiny little port. So we thread the cannula through the tissue in the layer that we want, and then we inject as we withdraw. I'm going to go ahead and insert the cannula. I've already inserted it into that small incision. We've numbed with some numbing cream in the beginning and allowed enough time. So I'm threading the cannula right in the layer that I want. We have a nice long cannula, so it'll extend across half of her lip. And right now I'm just at the vermilion border, right at the border of the lip, and I'm going to inject gradually as I withdraw. And you can see that lip filling right now.
Yeah, that is pretty immediate. Wow.
So that was about 1/10 of a cc, very small amount. We're going to inject a slightly larger amount. And each time we pass, we may go in a slightly different level or different plane. So now I'm going a little bit further inferior here into the pink part of her lip to fill the pink part. You can see that filling as I withdraw here as well.
This is filling in real time, and it is so cool to watch. Viewers, I don't know if you can see that happening.
I'm going to go further down in the pink part.
But we are watching this pout just fill up, and she's getting such beautiful shape and fullness in her lips.
So she needed a little more volume in her upper lip. Her upper lip was a little thin.
Are we trying to change the shape at all, or are we just trying to fill up her upper lip a little bit more?
In general, we're giving her more volume. She had a nice shape to begin with. We just wanted more volume overall. So we finished that half of the upper lip. My plan was she had a little bit of a thin upper lip, as you see on this left side. She could use a little more volume. She's got great definition of her vermilion border, which is one thing we want to achieve. If we have to, we can enhance that with a filler, but she already has pretty good definition. We want to enhance that a bit with a filler. We also want to add a little bit of volume to her vermilion and increase her vermilion height, the height of the pink part of the lip. This is what's going to make it look more full and pouty.
I see.
So we started with a small injection along the vermilion border to enhance that line, and then we added volume to the pink part to give a little more height and give that more pouty
It's looking
shape.
very natural also.
Right. So
as opposed to that duck face shape that
Right,
people are always
exactly.
afraid of.
You know, and exactly. People are afraid of that. They see that a lot, and they think that's what they're going to get if they have their lips injected. But it can be controlled. Very often, you know, I think too much is placed along the vermilion border here and not enough in the mucosa to add to the mucosal height and give more fullness to the lip. So my plan was to use about 6/10 of this 1 cc syringe in the upper lip and maybe 4/10 in the lower lip. So we'll see as we go. We may adjust a bit. We may put a little bit more in the upper lip, but we want to keep the lips in balance. You know, the aesthetic ideal is to have the lower lip slightly more full than the upper lip. Right now on that left side, or that right side that we've injected so far, she's pretty close as far as the volume with the two. So here I would want to add a little bit more volume to the bottom lip now that we've done the upper. But we're going to come over here, cross over to the left side, finish the upper lip with another 3/10, and then we'll do the bottom lip.
Now, what we're
okay?
seeing on the left side of her lip,
Mhm.
is she swollen at all? Is that going to go down, or is
Very
that
little
pretty much
swelling.
how it's going to look?
Right, and the lips will swell pretty early on, especially if we're doing injections with sharp needles. So you'll immediately develop some swelling from the inflammation from those sharp injections. You may even get a little bruising and a small hematoma. So there's another thing that maintains the sort of normal anatomy. This is very much what we expect to see afterwards, and we shouldn't have too much swelling because we're using this blunt cannula. And this is, you know, very much the result that we expect. Again, I have my small incision there.
Incision there.
We're trying to enter the space. There's a little potential space right along the vermilion border here, and we just need to get into that space with our cannula. We've done that. And now we're going to thread right along that lip line. You see the cannula passing along that right now.
It really does just look like a thread of filler. Well, actually, it looks exactly like what it is.
Yeah. But we can control exactly where that cannula is passing. She's got a little fibrosis there. Okay, but now we're right on that vermilion border. You see that fill as we inject. Now we're going to go more on the pink part of the lip.
Fascinating to me how you can see it in real time. Now, Dr. Polo, how long should the results last for her?
The products that we use for the lip augmentation usually are some of the shorter lasting with hyaluronic acids. They're a little bit less concentrated and less cross-linked because those are the ones that are safe to inject in the lip. So these should last 6 months at least. She may get a little bit more duration out of the treatment, 6 to 9 months.
So about 6 months of the perfect pout with just very little discomfort or pain. And with your technique, just one incision on each side as opposed to multiple incisions of the syringe.
Yeah, multiple needle sticks with a sharp needle. All right, so she should be pretty well balanced there. I'm usually fairly aggressive at massaging afterwards because we want to make sure we don't have any lumps. The cannula helps with that because we can inject as we withdraw as opposed to multiple injections with a needle.
So now you're done with her top
she's
lip.
in good balance. Yeah, exactly.
That looks
Let's see.
beautiful.
Open just a bit.
We'll give you guys a quick shot of her profile. But look how gorgeous that pout is coming out. And she doesn't have that overly filled shape that everybody's always so worried about. It's just a natural enhancement of the gorgeous shape she already had.
All right, I see a little more fullness on the left side, but I did have to pass the cannula a few more times on the left side. She may have just a little bit of swelling there. I know that I use the same volume, if anything, slightly less volume on this side. So I'm going to stop just where I am. I'm happy with that result. And we're going to move on to the bottom lip now. So we've got 4/10 remaining here. So we're going to try to evenly distribute 2/10 on each side of the lip here.
So just a slight little plump in the bottom lip just to give it that matching fullness for the top lip?
Exactly, just to maintain a little more volume and fullness of the bottom lip compared to the top.
And our patient is here so relaxed. It seems very comfortable.
He's doing great. Every now and then we may need to make an additional little incision here.
It's quite a relaxing room we have in here. It's probably why we're all about the namaste in here too. We're loving our new artwork. Quick shout out to Gaping Void for their beautiful new artwork in our Gables office. Viewers, if you're interested, you can actually order prints from us here in the office, so come by and see. They're amazing. This is just one of the many.
Okay? Yeah. Good.
So then you'll do the same on the other side for the bottom lip?
Right. Just a small augmentation there of the bottom lip.
Oh yeah, it's just a very slight difference. Viewers, I don't know if you can see the difference between the left side and the right side that he just injected, but it's just a slight enhancement on the bottom lip to match what he did on the top. What's great about the fillers is that you really do get immediate gratification because you can see what is being filled and what's being enhanced right at that moment, as opposed to other injectables like Botox or Dysport that take a few days to kick in.
Okay, we got our cannula position where we want it.
And again, we can see that left side filling in real time as he threads that cannula through.
That's it.
That's it.
A little bit of massage just at the end to make sure we've got everything evenly distributed and no lumps or bumps.
Just a natural enhancement for the perfect pout.
So there can be a little resistance in these planes where we pass the cannula. It is a blunt cannula. You know, it's not a sharp needle, so it can be a little bit difficult to pass through areas where there's some natural adhesions. But overall, you see just a tiny little incision, just one little needle stick, and with that blunt needle, even though it does require a little bit of force to get it positioned properly, you know, much less bruising and swelling than you're going to have with a sharp needle.
So this is pretty much what her result is going to be. She's not necessarily going to have to think that it's going to go down significantly from where she is right now, maybe a little bit, but...
Right, just a bit. And she should have, you know, very little swelling from the trauma of the needle. With these, you know, injectables that we use for lip augmentation, you do have a little reaction to the substance that's injected, and more reaction in that they draw in water, and there's some swelling from the water that is drawn in from the hydrophilic effects of the materials. But overall, this is pretty much what we should expect. Less bruising and swelling than with a sharp needle. She'll do a little ice today, and tomorrow she should be in great shape. We'll see.
We'll give you guys the profile view from the other side so you can really see, but it's just a slight enhancement, very natural, but just giving her a little bit more of a pout to fill the lips, but keep the gorgeous shape that she already had. Well, we hope you guys enjoy. If you have any other questions, feel free to leave them in the comment section and we'll answer all of them. Thanks for joining, and we'll see you later on this week as we zap some spider veins on legs on Thursday with Carolyn. See you guys soon.